February is Heart Health Month, I should say. Now, we know the startling statistics. Heart disease is the #1 killer of men and women in the United States.
But what we seldom talk about are the risk factors leading to heart disease in adults, which is fast becoming a growing epidemic in children. I sat down with an expert to find out what parents need to know to help keep their children heart healthy. Health experts agree the state of heart health in children is poor.
As a whole, I think that parents aren't aware that the little plaques that form in heart blood vessels that lead to clots later on that make heart attacks have already started in toddlers.
You heard right. According to pediatrician Dr. Cynthia Lee, fast foods and prepared foods with trans fats have already started building up plaque and working on heart attacks in kids as early as age 2.
And I've also found toddlers with high cholesterol as well.
Topping the list of controllable cardiovascular risk factors facing children right now is obesity.
Anybody who is overweight, their heart has to work harder. And the harder the heart has to work, the less it's going to last.
Followed by a lack of activity and diet. Dr. Lee says parents need to lead by example.
Get off the couch. Get off the couch. If you want your child to eat healthy yourself. If the snacks aren't in the house, they can't snack on them.
Health experts say it's important that children get the nutritional content from 5 food groups: whole grains, fruits, vegetables, meat and protein, and dairy. Now, if you can, natural and whole foods is best, but also important, portion size. For instance, for a child age 7 and 10, 1 serving size of grains is equivalent to this computer mouse, or 6 ounces. Fruit, a tennis ball, or 1 piece. Veggies, a baseball, or 8 ounces. Protein, a deck of cards, or 3 ounces. And dairy, 3 dominoes, or 1 ounce.
There's a tendency to overfeed the younger children, and that's what we need to make sure they're not doing.
A healthy diet works best if the whole family is involved in what's prepared.
If the snacks aren't in the house, they can't snack on them. So don't buy the groceries that you don't want them to have. 3-year-old is not going to be able to go out and buy groceries. So
the poor content of a child's diet and lack of portion control is leading to an alarming rate of yet another chronic cardiovascular disease.
Type 2 diabetes that comes up in children more often now than it used to is caused by the body being resistant to the insulin that it's making. In type 2 diabetes, you make insulin, but it just doesn't work very well because you have one of the things that is resistant is fat tissue.
So, what can parents do? If you don't know where to start, ask your child's pediatrician some key questions, such as how much activity should they have? If your family has a history of cardiovascular disease, how much at risk is my child given their body mass index?
Parents aren't aware that we track that. It's good information to know. It's going to tell you if you are being successful at, controlling the appetite, making them active, and staying in a healthy weight.
And what changes do I need to make in my child's diet to help make them more heart healthy? The best time to start a heart healthy diet?
2 years old.
Oh, really?
Really. Start making changes. Low-fat milk, low-fat dairy products. That's the time.